I'm Ariadna Masso. I'm the founder and the CEO of Sano. Sano is a platform that connects patients with chronic conditions with pharma companies and clinicians to find the best treatment and the best clinical research that can help them in this journey. So we are kind of a connector, if you want, and we solve two big pain points. One is access to patients, so from a recruitment side, but with a slightly different model. We go directly to the patient. And the second one is retention adherence. We work a lot with personalization to really hold the hand of this patient. So basically, I started Sano actually out of my own personal health condition. So I used to work in finance with private equity companies in London for many years. And basically in 2019, I was diagnosed with a chronic gut condition. And for me at the time was really a big shock. I didn't know what to eat. All the medications were actually causing me more flares than helping sometimes. So there's a lot of trial and error. And it's a very long patient journey. So basically I decided to study nutrition science. And that was the moment where, connecting with all the patients and doctors, I decided to build something in the space with this, very patient-centric approach that we really need in the industry. I would say, so there are two things. One is first owning this relationship with the patient directly. I think it's amazing because we really hold their hand and we ask them if Sano was a person, what it would be? And they say it would be a friendly nurse holding my hand during treatment and clinical study. And that is kind of connected with the second point, which is personalization. So at Sano, we have built an ontology that basically mirrors clinical protocols and personalizes the content that, for example, you might see based on your symptom group or even on your mood, on your stress level. We connect with wearable devices, so we're also able to give you a picture of that. And that content might be different as to what I see. So this personalization is really, really game-changing, and we are seeing above 90%. So on average, we have 93 to 97% adherence with patients in the context of treatment and clinical research. That's a good question indeed. So I will start probably with the failure first. So, we work kind of in a complex model because we work with patients, although the patient-facing interface of Sano is completely free for them. So how we monetize, right? And that's always the challenge, right? The go-to-market in health tech. And basically we also integrate with clinics, so sites, and we ultimately work with pharma, biotech, and CRO companies who have a research mandate to speed up and release new therapies. So I think the mistake that we did early days was trying to figure out who this payer was without really narrowing down the persona, the type of person that we are selling to. And, after different experiments and trying to really understand, okay, who are we selling to? Then that was really the pivotal moment for the company. But we made the mistake there early on, of not having that very clearly. And in terms of success, so, obviously there have been quite different proud moments. I think my team and I of the journey, especially when we hit the satisfaction from the patients and how we can help them during treatment and clinical trials. But there's specifically one milestone that I think we are all very happy about, which is that we won a program led by Johnson & Johnson, who ultimately resulted in them investing in our company together with Founders Factory in London. And to be honest, having those teams on board are just incredible, very helpful, and very hands-on with us. So I think we are very, very happy to have achieved that with such partners. Wow, lovely question. So basically, coming from London, and I'm originally from Barcelona, so the transition has been quite natural, but Barcelona is a great place to be. And we were wondering, okay, where we want to, like, this soft landing, right, in Barcelona, where we want to go as a first step. And we found that the Barcelona Health Hub has this unique ecosystem with very well-established players. So you find from pharma, CRO companies, insurers, digital health players, and literally, as I'm talking to you from the Barcelona Health Hub myself as a resident, it's happening as we speak, right? People just walk by and they introduce themselves, they say, I'm here, how we can collaborate. And this is just very unique. I barely find this anywhere else where people are so willing to collaborate. So that is why we joined, right? To really be part of this ecosystem and this collaborative group of people. So basically, first of all, I expect the hub to really drive a lot of collaborations, right? In the end of the day, this is what we need. And we are also part of an ecosystem, even with a hospital around of the hub, right? So again, leveraging on this very unique composition of the different stakeholders. And I also expect the hub to play a key role in bringing more international partners that are finding Barcelona as a strategic hub for healthcare. And I think we are seeing this recently with the hub, is bringing here international partners, arranging visits and meetings. So that's how I see the future of the hub, really playing a key role with these connections and helping even further make more innovations. Well, thank you so much for this opportunity, the interview, and I would love to connect with other members of the Barcelona Health Hub that maybe are not residents and they are even in other locations. So I'm very, very open to collaborations. My email is ariadna@sano.health, Sano with double N. And I would love to continue the spirit of collaborating. Thank you so much.